Patients with the heart disease, can be symptomatic or asymptomatic. In your opening statement, you said that 1 in 5 heart attacks are silent. The damage is done before they know it, right? So, for preventive aspect, we investigate the patient if they don't have symptoms a little bit differently. If the patients have symptoms that are concerning for heart disease, say for example, somebody has chest discomfort, pressure, heaviness. In Southeast Asian population, commonly described terminologies are gabrahat, gabraman, or uneasiness in the chest. Also, Southeast Asian population commonly have presentation of burping. They feel like it's the indigestion, it's a gas, but it's not that, it's heart. Palpitation, feeling like your heart is racing or your heart is skipping beat. Shortness of breath. When before you could climb 2 flights of stairs easily, now you get to the 2nd flight of stairs and you feel a little winded, you're having a little bit shortness of breath. If that's happening, that are symptoms. When somebody has symptoms, then we investigate them a little bit differently. So if somebody does not have any symptoms, our goal is to make sure we detect high blood pressure, diabetes, cholesterol levels or high cholesterol ahead of the, before it starts causing damage to the heart and the body. If there are patients with high family history risk, but their cholesterol and diabetes, everything is fine, at times we use something called calcium scoring in the heart. So you can do a CT scan of the heart and find what is the amount of calcium, and based on that, we become aggressive in how much medication and things we can use to control the risk factor. Now, if a patient has symptoms, depending on symptoms and presentation, we investigate them differently. If a patient came to my office and says, when I climb a flight of stairs, I have these symptoms, I may do a stress test. I do first the cardiogram. The electrocardiogram gives us a lot of information. It's like, for us, it's like 5th vital sign. And once that is done, we can do exercise, EKG or stress test to reproduce the symptoms. That tells us that when the heart is in need of more oxygen and energy, is there enough blood supply? Is the patient having any symptom? Is the blood pressure responding to exercise? Is the cardiogram changes with the exercise? So we can do that kind of test. We also do something called echocardiogram if we find that this patient is likely has suffered a silent heart attack. So by doing a sonography of the heart, we know if there is any damage done to the heart muscle or not. So these are the different testing we use to investigate. If a patient came in with similar symptoms into the hospital in an emergency situation, and we saw something on the EKG, then all these tests are not needed, and what we may need to do straight is doing catheterization. So we can go through the wrist artery to the heart, inject dye, take pictures of the heart arteries and see if patient has a blood clot in the heart artery or if they have a blockage in the heart artery, and then depending on what it is there, we can treat them differently.